Hello friends, today we will be discussing important topic that is calibration. We will be discussing its definition, scope, frequency and importance. So calibration of an instrument is the process of determining its accuracy. That is, the process involves obtaining a reading from the instrument and measuring its variation from the reading obtained from a standard instrument. So it can be defined as calibration determines if a device or the instrument is producing accurate results within the specified limits compared to those produced by traceable standards over an appropriate range of measurements. The instrument or an equipment with the known accuracy, as we all know, is known as standard. All other instruments are measured against this standard. It is important to know that the standards may vary from one country to another country depending upon the type of instrument. Calibration achieves two main objectives. Firstly, it checks the accuracy of the instrument. Secondly, it determines the traceability of the measurement. Coming to the scope of the calibration or purpose, calibration is primarily done to achieve five purposes, which are: first, to make sure that the readings of the equipment or the instrument are consistent with the other measurements and displays the correct reading every single time we use it. Secondly, to determine the accuracy, precision and deviation of the instruments produced by the instrument. Thirdly, to establish the reliability of the instrument being used and whether it can be trusted to deliver a repeatable results each time. Fourth, to map the drift as documented. What is the drift? Instruments have a tendency to produce inaccurate measurements over a period of time following repeated use. That is called as the drift that we have to map and document. Lastly, ensuring that the industry standards, quality assurance benchmarks such as CGMP regulations, government regulations are adhered to. Frequency of instrument calibration. How often we conduct instrument calibration mainly depends upon its tendency to drift from the true measurement and how it impacts the quality of the end product. Examine each instrument being used and study its behavior. Based on this information, we can design a calibration schedule for each instrument. The interval between the calibrations may vary from weekly, monthly, bi-monthly, quarterly, biannually or annually. Calibration is also done after every heavy usage of the instrument. The frequency of the measuring instruments depends on number of different factors. As a part of GMP, the following can be guiding outline when the instruments need to be calibrated. As soon as we bring a new instrument, we should calibrate it before we get it out for test. Before and after we take a critical measurements, we should calibrate an instrument after any instance of electrical or mechanical shock or a similar event that includes a fall or a bump, etc. When we suspect that the accuracy of the measurements being produced is questionable. If there are any repairs or requalification of an instrument, we have to go for calibration. As a part of regular calibration schedule, depending on the task and processes, as some requires calibration to be conducted before the work starts, and lastly, according to the manufacturer's recommendation, we have to do the calibration. Other variables that helps in determining the calibration frequency may include criticality of the measurement location, stability history of the instrument, before extremely important measurement, workload and operating conditions of the instrument, sudden unforeseen events, and discrepancies suspected in the final product. So these are the other factors which are variables which are responsible for the frequency, deciding on the frequency of the calibration. Now, calibration method. There are different ways that are used to calibrate an instrument. These methods are chosen based on the desired results of the calibration, regulatory authorities' requirements like FDA guidelines. There are three such procedures. First is standard calibration, second is calibration with data, third is ISO 17025 accredited calibration. So standard calibration. This method is mostly preferred for calibrating instruments that are non-critical to quality or are not required for accreditation or licensing purposes. It uses traceable standard and documents its performance. Second is calibration with data. Procedures for calibration with data are similar to that of accredited calibration that we'll be seeing next. The only exception being that these procedures are not accredited to ISO standard. Moreover, they are not accompanied by data on the measurement uncertainties. Last is ISO 17025 accredited calibration method. This has to be the strictest method of calibration, as generally it requires a measurement report which has the details of the measurement that are made against a standard of as found, that is before the calibration is started, and as left once the calibration is completed. If the calibration is done by calibration service provider, they must issue a certificate for the same. Now, what might happen without calibration? First, ambiguous quality. The measurements will become faulty and discrepancies will be seen, which will reflect on the final product, and this will result in the questionable quality of the product. Second is safety issue. In the pharmaceutical industry, the quality of final product holds extreme importance because it can affect thousands of lives. Non-calibrated instruments will cause wrong measurements of raw materials when producing medicines, or instruments of sensitive nature such as thermometer, which can cause serious safety threats to the final users. Third is misuse of resources. Non-calibrated instruments will waste time and resources which prove expensive in long term. Third, next, next downtime increases. When final product shows deviation, shutting down the process to conduct complete recalibration is required. This results in increased downtime. Last is risk of litigation. If the customer suffers seriously due to the low quality of the product, they will return it and ask for full refund or press a legal charges due to the damage. So that will be held the company into litigation. Lastly, the importance of calibration. Calibration is responsible for defining the accuracy of any measurement, and its quality that is recorded by the instrument. When we start working with any instrument, it must be calibrated well, thus assuring us the accurate results. However, over a period of time, we might start observing a drift. So calibration minimizes such uncertainties by assuring the accuracy of the test equipment. When we regularly calibrate our equipment, we can eliminate the drift at its budding stage instead of allowing it to grow till it affects the measurement in a significant way. Calibration helps in quantifying and controlling the errors and uncertainties within various measurement processes to an acceptable level. It also helps in improving accuracy of the measuring device, which in turn improves the quality of the end product. In short, regular calibration allows pharmaceutical companies to have a confidence in their result, which they can record, monitor, and control. Summary that we have discussed in this presentation. So to summarize the presentation we discussed definition of calibration, its scope, what should be its frequency, procedure of calibration, and lastly the importance of calibration. So thank you very much. We'll be discussing another topic in another slide.